Thank you. Thanks, Joe and PJ. Thanks for setting us up. Thanks so much, guys, for inviting us over to you this morning. Definitely feel honored as a startup. We've been kind of doing this thing for a couple of years now and getting ready to launch. And so being in front of you here to present our product and get some questions from you and get some help as far as guidance is totally awesome, and we definitely appreciate it. I'm Dimitri. I'm the CEO of Norah Health. Dan Hoffman is our Chief Operating Officer, and Philip is here from Dallas, Texas. He's our Chief Technical Officer. We have all these flashy names. Isn't that cool? Our logo here at Norah Health is basically we're growing the patient experience. And so what our company does is that we focus on the patients. There's so many different tools in healthcare to help with clinical development, to help with providing the patients with the healthcare that they come to the facility to get. The thing that we focus on is a very important part of the market, and that part of the market is to make sure that the patient gets a good patient experience. And make sure that when the patient comes to our facility, not only are they getting the right clinical care, but they're also coming in there getting a good experience and then wanting to come back and wanting to come back for future services and improve outcomes as a result. So what's the problem? The problem is the fact that in 2012, Medicare specifically started to measure the quality of patient satisfaction. So there's this flashy term that everybody uses in the industry. It's called HCAHPS. Specifically, that's a survey that gets presented to patients after they have healthcare provided in a facility. And so this survey looks at the quality of patient satisfaction that the patient received. Did we abide to their privacy concerns? Did we abide by the fact that did we answer their questions? Were they able to get to their facilities right? Did we give them good discharge instructions? And the reality is that the problem right now in healthcare is that, as you can see on the slide, more than 1,300 hospitals are losing Medicare reimbursement every single year because they can't figure out this problem. And what's happening is that just on the Medicare side, we're not even talking about the soft dollars of loyalty, it's a $3 billion market. So of all the money that Medicare is reimbursing hospitals, and there's over 5,000 hospitals in the United States, what you're seeing is 1,300 hospitals are leaving money on the table every single year, not getting all of their Medicare reimbursement because their patients are saying that the quality of patient satisfaction that you provided was not to the level that they wanted. And the way that this value-based purchasing works is that the hospitals, the blue ones in that bar graph, those hospitals are getting rewarded. So this is a pot of money. And it's actually 0.5% of every Medicare dollar is part of this value-based purchasing for patient satisfaction. So the hospitals that are in the blue, they're taking money essentially away from the hospitals that are in the red. And so clearly, $3 billion market, hospitals have a lot of incentive to improve this. So we believe, and Dan and I are both administrators in healthcare at one of the major facilities here in St. Louis. We're both people who have provided direct patient care, and now we're administrators. And what we have seen, and what's really difficult for us, is that we feel that healthcare is missing the mark when it comes to providing the patients with the quality of service that they come to see. So I was talking to Tom earlier today. What you have is you have a patient who's coming into a facility, they're scared. They don't want to be here. This is not the Marriott or Ritz-Carlton. They're coming in because they got to get blood work done. They're coming in because they have some kind of a lump that they're having to deal with. And the fact is that if we can make their experience better and connect with each patient, well then in that case, they're more likely to follow the instructions that happen afterwards. They're more likely to actually listen to the healthcare provider. And so going along with missing the track here is what's happening in healthcare today is that we are putting all of our patients into a box. And so you're lucky if you're coming into a facility that has the ability and has the training for their staff to put 20 or 30 patients into a box and to say, when you're having a patient coming in for this type of a pain on the side that's probably attributed to renal pain, do the following things and then they will get a good experience. And so what we have noticed, and really where this idea came from, is the fact that you can be so proactive. You can train your staff over and over again. You can give them tools. You can script them. And what happens is that your patient satisfaction scores go up and then they go down because the patient demographic changes. The disease changes. The physicians that you have serving those patients change. All the staff that you have changes. And so what happens is that you're treating people as best as you can, with a certain type of a script or a certain type of training to say, okay, this is the type of care you need to provide. And so what Norah Health does, and this is our algorithm, is that you see we're calling this patient Cindy. So Cindy is in that crowd, and what Norah Health is able to do and what our algorithm does is we put the box around that patient. So we specifically are able to engage with the patient before they come into our facility to find out how they like to be communicated with, to find out what their concerns are, to find out when they come into a healthcare facility, what are the things that burn them, or what are the things that make them successful. And so we have developed an algorithm that basically looks at the patient and then tells the healthcare provider exactly what they should do, in this case with the patient Cindy. But the reality is that Cindy is one of thousands of patients that a hospital is going to see on any given day. And so we are able to draw a box around Cindy, around Tom, around John, and let me take you basically through what our product looks like. So who's in healthcare here? All right, perfect. Well, so you guys probably see this often. This is electronic medical record. This is an order for Cindy, who's coming in to get treated for breast cancer. Okay, Cindy's a 62-year-old lady, and so what we're seeing in the electronic medical record is lots of clinical information. So we're set. We know how old Cindy is. We know what diseases she has. We know what kind of treatments she has. We know all the clinical information. So we're definitely able to deliver the care in that regard that she needs. What we don't have is we don't have the solution, which is this yellow box. And this yellow box is basically our product. And what you're looking at here is you're looking at specific interaction recommendations. And so based on our communication with this patient Cindy ahead of time, and based on an algorithm that we go through, based on what disease she has, how much she's been treated, what demographic is she in, where is she coming from, and different things that our machine learning is also being able to put in, like things that are outside of healthcare control all in all. We're able to provide the healthcare delivery personnel interaction recommendations. So in this case, if there's a nurse who's dealing with Cindy, that nurse is going to know that this patient is chatty. This patient is going to want to talk. This patient is going to want to ask a lot of questions on their visit that follows. They're going to want to know that if you're doing a specific procedure on her, you need to explain every step of the way, because if you don't, she's going to be asking lots of questions. And if you don't give her that time, she's going to leave and rate you as a bad experience, because she came into the facility with the expectation that she's going to have lots of questions and you're going to answer her questions. Well, this particular nurse, if she didn't have this yellow box, he or she didn't have this yellow box, well then that nurse is coming in and trying to, in a 5-minute period, trying to figure out, how am I going to connect with this person? Is this person going to be somebody who's going to ask a lot of questions? Is this person not going to be that person? And so what we are able to do is through getting the initial communication out to the patient, looking at specific things in the electronic medical record system, we're able to provide interaction recommendations both directly from the patient and through an algorithm to say, these are most likely to work. And then the really cool thing about what our software does is that with every single recommendation and every single encounter with the patient, Norah Health gets smarter. And it figures out what has worked, what has not worked, what works with these clusters of patients, what doesn't work with these clusters of patients. And so every single time the patient comes back, we're able to better connect with them. And so the goal of this is that these HCAP scores that Medicare is directly looking at to control reimbursement on, we are looking to improve those HCAP scores as a result of this. And also do the right thing, which is to improve the patient satisfaction and have a contribution to outcomes and have a more likelihood that the patient is going to follow their discharge instructions, follow their appointments, and so on. Excuse me. So what is our status? We have come a long way. Dan and I, this idea was born a couple of years back when, I'm sorry, Mary's giving me instructions. I've been in this box this whole time.
That part's good, but you have to use the mic.
I have to use the mic. So this idea came, as I told you, from the fact that we were in a situation as administrators where at 3 months at a time, we were either the best thing that ever happened to patient satisfaction and everybody in the hospital was coming to us, and then 3 months later, we were the ones that were on the target list of, why are you guys messing up? What's wrong with your group? Why are you not able to deliver this? So the idea came from there. We've been 2 years in the making. And so where we are right now is we've set up a demo, and this demo is an interactive demo that we are presenting to our potential first customers, where they can see how the interaction is going to happen with a patient ahead of time, how that yellow box pops up for the healthcare providers, and then how the communication happens with patients afterwards, and also provides analytics. So we've been test driving this with some potential customers with customer discovery, and that has been awesome so far, really good feedback. Our MVP actually just happens to be, it's going to be completed next week, so a couple years in the making, and we now have a software that is going to be able to be hooked up through an API into an electronic medical record system. So that's really, really exciting. It's crazy that's on the slide. That's going to happen next week. We're working on our provisional patent right now. That should be done very shortly. And really where we are right now is speaking with potential customers. I was talking to Joe, and we have lots of fans, and we're trying to start figuring out how to convert those fans into potential first customers, into actually putting our software in and trying it out. And so our potential first customer is going to be either a hospital, is going to be either a small doctor clinic that can test drive some of this stuff. And also we've had some discussion with vendors when they're bringing a product into a hospital or into a healthcare facility. We're able to pivot our product to be able to come in along with them and improve the compliance of their product by using Norah Health. So how can the community help? So really right now, what we're looking to do is we're looking to be connected, and we're doing some of this by ourselves, and obviously help would be super welcome. We're looking to connect with hospital decision makers. So as far as the executive directors with patient excellence and patient experience, we're connecting with those folks, and we're having really good traction. So now our goal is to convert those connections into people who are willing to spend some money, willing to put some workforce behind our product. The other thing that we're working on is either engaging another entrepreneur on the psychology front, or looking to collaborate with an academic center to have some psychology component to our product. So based on lots of research that we've done, we've written about 1,500 interaction recommendations, and we've actually done a couple focus groups with potential patients, and the feedback has been phenomenal. It's really been a very great, measured by metrics, been a really good outcome. So what we're looking to have is to hook up with somebody to basically help us with these interaction recommendations and to continue writing them. So we get to a point where we're vetted with somebody who's actually in this space as far as psychology and patient satisfaction goes. And then finally, this is probably in everybody's presentation, is establishing a roadmap for finances and figuring out how we can bring money into our company, getting some resources in there so we can actually break that threshold and get into a facility and start using this product. That's all I have.
All right, as per usual, please wait for the microphone. If you have questions, who would like to start?
Thanks, Joe. Good morning.
Good morning.
A very nice presentation and good product, but I have two questions. So the first one is, you mentioned HIPAA. So at some point, you have to interact with private information. So how do you get that authorization to access that? And then the second one was, I assume you not just be targeting everybody, but you're going to micro-target patients that are supposed to come to this facility. And you're going to, like in the case of Cindy, you want to talk to them, because Cindy says she doesn't like needles. So are you going to have human, interaction, like you call them personally, and then you use that into your machine learning processes, or how does that work?
Thank you for the questions. And I have my partners here who may just jump up to answer. Do you want to answer the HIPAA question?
We'll start it.
Okay. Well, so HIPAA is I mean, you hit the nail on the head. HIPAA is a very important part of our software. And so Philip here has built a couple different softwares in the past that has integrated directly into healthcare. So we have seen, we have worked through some of the layers that a healthcare facility is going to put us through to make sure that we are HIPAA compliant, and we're going to make sure that we don't have any barriers to the patient data. So very important part, something that we are definitely focused on, and we've built our software knowing that that's going to be a major thing that we have to answer to a potential customer. Anything you want to add?
How you doing? I'm Philip. Yeah, just to follow up on that, security has been a thing from the very beginning. I currently work for a internet security company outside of Norah Health, so it's always on my mind. And I previously worked at a pathology lab where I did development there, so we had to be HIPAA compliant. So that's something that's always been in the back of my mind when developing. As far as access to patients, we're going to have to work with the medical facility, the clinic, the hospital to get consent from that patient. So as far as communicating with the patient, we can't do it unless we have their consent. So it is going to be a interaction, a personal interaction to where we can actually communicate with them via text message, via potentially email. And of course, there's also the security concerns around HIPAA and security concerns around those interactions. So, you know, this is an ongoing process that we're trying to figure out, but we do have some potential solutions on how to interact with the patient. So, does that answer your question?
Absolutely. Thanks. And I can answer that question about how we interact with the patient off the start of the visit. So what we do is we text the patient before their visit, and that's very common in healthcare to send them appointment reminders because that helps decrease hospitals' no-shows. So that's how we would interact with them off the jump. We would just shoot them a text, hey, quick reminder, you have an appointment at 9 a.m. on Tuesday morning. And then at this facility, we like to get to know you a little bit better so we can customize your experience and make sure we optimize your experience at the facility. So we ask a couple targeted questions just to get to know the patient a little bit, and then we extract that information from the electronic medical record, and then so we know a little bit about that patient, who they are as a person, and then we know what's going on with them clinically, and then we can make a recommendation to those providers on how to better that patient experience. And we think that's actually going to be a good thing right off the start, just to set those service expectations with the patient in the beginning, just so they know that that's our expectations, that they get a great experience. Thanks a lot for your question.
Hey guys.
Hey, how you doing?
Good to see you.
Yeah,
I'm
you
so
too.
excited to see your progress.
Oh, thanks.
Hadn't chatted with you recently, so it's exciting to see how much progress you guys have made this year. You touched on it a little bit, but can you talk a little bit more about your strategy for getting paying customers? Because I think sometimes you're the type of product that might be solving a pain more effectively for the person who isn't paying for your product. So you have to convince the person who is paying that they have a pain that needs to be solved as well. That challenge. So can you talk a little bit more about your strategy for convincing the people that are actually writing your checks?
Sure. Yeah, so really our goal right now is just to trial the software at either a healthcare innovation lab or just do a beta test with a small department. So patient satisfaction, like individual leaders in a unit are definitely incentivized to have their department have high patient satisfaction scores, so that would be a target customer. And then there are usually system-wide or hospital-wide leaders that are in charge of patient experience, so that's who we've been kind of focusing on and talking to, and we've gotten some good traction, but there is hard dollars behind this with that HCAP survey, so definitely it is a strategic priority for a lot of hospitals to improve their patient experience scores. So that's really who we're targeting, and just looking to get into one facility, prove this algorithm works, and then try to kind of land and expand and move it into other departments and then other facilities. Did that answer your?
Yeah. Let's chat more when we're done.
Okay, sounds great.
I'm also going to add to this that at the last 2 academic facilities I've worked at, I've seen hard dollars behind how employees are being paid by the facility as a result of their department's, kind of that big box around all those people, their department's success in providing patient satisfaction and where they are at a quarter at a time. So the reality is that the payment structure for Norah Health is going to be either a fixed cost or it's going to be directly determined based on how much money the healthcare facility is collecting due to the reimbursement that they're gaining. And so the fact is that because of there's hard money associated with that hospital making more revenue, we feel that that the decision makers are going to see that there's a tie there, and then and that's how we're going to get our first customer as far as payment goes, because their revenue is they're going to see on their balance sheet revenue growing as a result of Norah Healthcare, and then they're going to see an expense is associated with that growth.
Back with HIPAA compliance, have you all spoken with or met Jerry Cassad with HIPAA Complete or Safety? So he's a T-Rexer up on our 8th floor with his company's HIPAA Complete, and he is, it's all above my head, but he's got a grant program organized right now called the Safety Grant that he's giving out like $10,000 equity free, I believe, to work with him and incorporate some HIPAA compliant software. So I can send you guys a link to that. I believe October he was going to announce the next cohort that he gave the grants out to, so I think there may still be time on that, but at least worth checking out.
Yeah, that'd be great.
That would be awesome. Thank you.
Hi, this is great. In your focus groups with older people, do you ever talk to the caregivers? Because a lot of times the experience has to do with the clinic is doing one thing, but there's other things going on with that patient, and if they're not paying attention, or if they're not asking the right questions, you're going to have a bad patient experience. So I was also thinking that if you can get like the Department of Bone Health or the Department of the Orthopedics, because you end up with lots of hip replacements, replacements, things like that at that age. And that's where you get this is the problem they're dealing with, but there's other things going on with the patient. And
That's definitely the case. So kind of having a little break.
Yeah,
just talking to caregivers.
No, that's a perfect question. I appreciate that question. So basically what happens is we have those interaction recommendations, and then what the machine learning does, so those interaction recommendations are tied to electronic medical record data points and then the patient profile. So then what the machine learning does, let's say we have interaction recommendations and 10 patients get these interaction recommendations. 8 of those patients give us a high survey score and 2 don't. What the machine learning does is look at the EMR data points for those 2 patients and say, what's different about these 2 patients? And let's say in this example, these 2 patients are getting chemotherapy. Well, then we would add an additional data point to the algorithm, and we would come up with additional interaction recommendations for those types of patients. And so that's how the machine learning gets smarter over time. Our algorithm gets more specific, and our interaction recommendations get smarter. So the AI, or the machine learning and the software is constantly looking for additional relevant data points that we can use to better optimize the interaction recommendations. Is that kind of your point?
Yeah, that's great. It also occurs to me that you might want to connect with some of the insurance companies that cover malpractice insurance, because better patient experience, fewer suits.
Yeah.
If you can avoid those bad experiences, you have fewer suits, and
Right.
that's cost savings.
Right.
Not just you're leaving money on the table, but there's additional cost savings there.
Yeah, no, great point. And we've actually talked about doing a little bit of a pivot, and we presented this idea to a company called DigniCap, and they customized a cap for chemo patients so they don't lose their hair, and they wanted to quantify their patient experience, and they wanted to help with the compliance of using the cap with the nurses that are administering that treatment. So there's another opportunity there where we could kind of get more into industry, healthcare industry, and selling products to patients, or helping companies know what patients want so they can better customize their solutions. So, and then the other thing we do with those interaction recommendations is we actually survey those interaction recommendations to see if they were used and how relevant they were to the patient. So it kind of incentivizes those providers. So say like with this DigniCap thing, we could actually find out if the nurse was offering the treatment, how they were doing when they gave the treatment. That way that company knows, hey, is my solution that's in this facility being utilized correctly by the personnel in that facility? Yeah, thanks for your question.
Yeah, I'm going to follow up on that. I think
Yeah.
that's actually the biggest
interesting point in that there are a lot of people doing what you're doing. So my brother is an executive at Norah Health, and so they get approached by people who do machine learning on patient profiles all the time. And the biggest problem is your yellow box in the chart that you highlighted. That's your biggest issue. Is like you should talk to just tons and tons of nurses to see how best you can get that information on the patient into their hands, because they're just totally overworked, right? You know, the night shift comes on, all they care about is the vitals and stabilizing everyone. They don't really have time to look at the yellow box and remember, oh, Cindy likes blah, 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 right? And so you might want to talk to them to see what would work in their current mode of operations. That's really important, because you can give them all the information you want. All you're going to do is overload them. You want to present it in a way that, you know, maybe a 2-second blurb somewhere at the beginning of the meeting or something like that. Okay? Just talk to them to see how it works in their practice parameters.
Sure, no, we appreciate that. And obviously, staff and healthcare providers' compliance with the action item is going to be very important for our software to work. And so currently, there's a lot of work being done to incentivize nurses and incentivize x-ray techs to improve the patient experience. And they're just broad things, like you're going to go to a class on how to better talk to a patient, or you're going to try to figure out how to communicate better. But with our interaction recommendation, there's basically we're asking you to do just 3 little things with the patient to improve their experience. And you're already going to be interacting with the patient anyway. So we're trying to put those conveniently in the EMR where they'll see them. And then the other thing is that we can break these survey scores down to the individual contributor level. So right now, we can't find any company that's able to say, like, let's say you're looking at a hospital and you look at what's the patient experience in radiology. So that's a big department, and you can see how they're doing. But how do you know how Joe, the x-ray tech on night shift, how do his patients rank him? So it's kind of like, we like to compare it to, a cab driver versus an Uber driver, totally different experience. Well, that Uber driver, they're going to be ranked when you get out of their car, and that rank's going to be tied to them, not to Uber. So we're able to incentivize individual contributors in the hospital to use these action recommendations and to improve the patient experience, and then that data can be used by the facility to reward them or to coach them. So like we could see with this algorithm, we could say, hey, these are in radiology, these 20, 30 people, they could really use some help with their patient experience because they're getting low scores. And they might be awesome clinically, they might be awesome technically. They just need a little bit of help to kind of, to improve that experience, and then they could be totally well-rounded.
Have you thought of doing things outside of the hospital, like in conjunction with the hospital? Because my point is, all your data, you're basically at the mercy of who's using your data to do stuff. Have you thought about just going, like you said, you have to contact the patient ahead of time anyway. Could you provide an experience that coexists with the hospital? Basically, you become the PR representative and make sure things are smooth and operate. So my point is, you're giving all this information to someone who doesn't have the time to really use it. With you guys, you could do that outside of the hospital, right? In conjunction with the hospital, provide the patient experience, shepherd them along the way, and provide a huge value added and basically charge 10 times as much.
Yeah, I don't know if I understand. So how are you saying we would interact with the patient?
Have your own patient liaisons, like either through the text or through something, basically you basically become the patient advocate, kind of, in that if something's going wrong, they text you and you somehow convey that to the staff. Because again, the point is all this information is just overload. I'm just wondering if that is something because everyone does similar things. They take patient profiles and provide the yellow box to the physicians and don't have time to really present this. So you could be giving great information, and if their execution sucks, you're getting a bad rap as well.
Yeah, I understand what you're saying.
And I think this is really good information. We have built our product that we are communicating with the patient at this point, before their interaction with our facility and afterwards. The thing that Dan is talking about with DigniCap, that was actually kind of a pivot to our program where we built it, where we're interacting with the patient the whole time. Certainly something that we can do, and the reality is that we can customize this particular product to how that facility or that hospital is looking to use us. When we met with a potential customer, depending on how busy the facility is that we're going to bring this to, actually a director of patient excellence was talking about the fact that if the nurses, before they see patients in radiation oncology for the day, they can look at all the patient profiles ahead of time, and they can say, oh, this one would be good for Joe, and this one would be good for Tina, and actually distribute patients based on what the interaction recommendations are going to be, then that helps them. Because the idea of this is that, and this is one of the barriers, and we understand this is one of the barriers for us to come in, is that this also has an employee engagement component to it. Because if you're giving employees tools to better interact with their patients, and then they're spending less time having difficult conversations with patients, and also getting rewarded after the fact because they're following these interaction recommendations, then there's success that's there.
I think you're just going to figure out in the trials. I mean, that's
Yeah.
basically, you have to battle test it.
Absolutely, thank you.
I have one thing to add on top of that. As far as the direction that we had been going, since I don't currently work in the medical industry, when I was developing the product, I was starting to go one direction as far as how we should interact with the medical facility. And after some plenty of discussions, we figured out, I was building the application to either sit inside of the EMR as its kind of own standalone application, but inside the EMR, or even potentially outside the EMR. And they're like, no, that's not going to work. Because if you introduce one or two more clicks to someone's workflow, a nurse, a physician, some sort of clinician, then you are diverging their process and they're not going to use it. So that's where, we started to go a different direction. We said, okay, we need to make sure that it's as easy as possible. The information is just there because we know that these people are busy and don't have time. They don't have time for us, but we need to make sure that we make time for us.
Okay, the healthcare system has a lot of red tape within their processes, and you have the patient, the doctor, and the nurse, and other participants. What type of incentives would you give to those partakers to do that extra click so that you could get that data into your system?
Sure. And so just to be clear, there's no extra click to get these interaction recommendations. They flow directly to the order where all the other patient information is. So if I'm a provider and I'm in the patient's EMR and I'm looking at what test I'm doing, I'm looking at the patient's disease, I'm going to see the interaction recommendations right there. So it's conveniently placed right where I get all of my clinical information. I'm going to see this interaction recommendations information. And then so currently hospitals are incentivizing their teams by giving bonuses for high patient satisfaction. So if your department scores at a certain level, your team can get a monetary compensation, a bonus for hitting the mark with patient experience. And then we can break down that data a little bit farther. So if that facility wanted to get creative and actually reward individuals based on how well they're doing, we could come up with a formula to help them do that. So there is a lot of money at stake, and that's just the CMS money. So there is a whole loyalty component. Like if you give a patient a good experience at your facility, they're way more likely to come back to your facility. That's going to help you grow your volumes. They're way more likely to tell their family, their friends, hey, I got great care at X hospital, and then come back. So there is a lot of incentive to utilize these recommendations and to improve the experience at a hospital.
Great presentation, love the product. Seems to me that one of the key things, especially at the beginning here, is those 1,200 or whatever action items that you've got in the database. Once you get going and you get high fidelity responses from whether stuff is working and the machine learning takes over, those will get more clear. But right off the bat, how are you demonstrating that those are effective action items to take to the first couple customers that you're lining up?
Sure. So that's a great point. And what we've done with the interaction recommendations so far is run a couple focus groups and trial the interaction recommendations. So to be honest, they are going to need to be tested. We are going to see which ones correlate to a high patient experience score. It's way better than what is currently in the industry. I mean, we're in this industry, we see this every day. That's why we created this thing, is because we didn't have a good tool to consistently improve patient experience. So right now, we can't find any company that is actually using machine learning to give an interaction recommendation to improve a patient experience. And that's kind of where we're at. So we will have to test the interaction recommendations and have to improve them, just to be honest. They're not vetted. We haven't trialed them on 1,000 patients. That's kind of where we're at. We need to do a small test, figure out what's working, what's not, and make it better.
Great, so I imagine, that's a huge sales piece for those first couple times.
Yeah.
Like, how do I know this is gonna work?
Right, but so what they're doing now is they're telling their staff, hey, be nice to the patients. I mean, this is literally what's happening, and I'm not being, hey, when a patient asks you a question, answer the question. Hey, smile at your patient. Do you know what I mean? So what this is, it's customized, and there's no custom. You have to tailor the care and give patient-centric care to give a good experience. Because if you're treating all those patients in the box the same, they all want different things from their healthcare facility, and this is just a tool to help figure out what those. So some patients are going to come in and they're going to talk to you for 5 minutes, and they're going to ask you 20 questions. Some patients are going to be looking at their watch the whole time, like, why is this taking so long? Why is this guy giving me a 10-minute explanation on my PET scan? I got to go to work. So there's just that's just helping them, giving them something to think about, giving them a tool to improve that experience. Yeah.
We actually, one of the focus groups we ran, there's like a middle-age focus group, and one of the gentlemen in there, his name was John. He was the guy who was like looking at his watch, and he's like, when I get into a healthcare facility, I want to get in and I want to get out. I want to minimize the amount of talking. I just want to know what happened, and then I need to go back to work. And we did the patient interaction with him ahead of time, and then we did the presentation of the action item, interaction recommendations. And it was amazing because he came out of that focus group saying, oh man, I can't believe you guys totally hit this thing on the head, because our interaction recommendations were specifically like, introduce yourself to the patient, tell them who you are. The second one was tell them the steps you're doing, and the third one was tell him how to leave, and then how he's going to get the results. And so that's exactly what we hit. And the other person in that focus group was somebody that we spent a lot of time explaining what's going to happen. So it was kind of an aha moment for us. One of the things that we want from the community, and we're working on right now, is to get a psychologist, to get an academic facility that's going to help us, because we have, I think, what is considered to be the starting point as far as interaction recommendations are. I took a whole certificate program in patient advocacy, so I built some knowledge around that. But the reality is that in order for us to be long-term, we have to have somebody on our group that knows what the patients are wanting, that knows how the patients are evolving, that knows the divisions that we're working with. So we're aware of these things, and we're kind of going towards that route.
Yeah, and just in like that example with like John, he's looking at his watch, he wants to get in and out of there. What happens when John's in the hospital for 3 days? Or so, what happens if John gets a serious illness now and his criticality is going up? How does his wants and needs change? And how does the facility respond to that? Currently, they don't have a way to do that. So that if Norah, that's what Norah would learn, as the patient changes, how the interaction needs to change. Thanks for your question.
Last question. You got it.
What have been some historical precedents for software companies approaching hospitals? How have they been able to picked up by hospitals? And as well as, what's the interaction like with these current software providers for hospitals?
So let me just make sure I understood your question. So basically you're saying how are software companies currently selling to hospitals, and what that relationship looks like?
Yes, so ones that are already in the market, do you have a historical understanding about how they got there? And as well as the ones that are in the market currently serving hospitals, do you have a relationship with them with which to offer your service to them and not directly to the hospital?
Oh, so you're saying if we would pivot and sell our product to a software company that already has a relationship with the hospital?
Yes.
Got it. So we've talked about that a little bit, because that is going to be a little bit of a hurdle for us, because we are a small startup and we are going to integrate with an electronic medical record, and we are going to have access to healthcare data. And that is going to be a little bit of a tough sell for a first customer, because we're a little bit of an unknown entity, and we're going to have some pretty serious patient health information. So we have talked about going that route and maybe talking to an existing player in the market and seeing if that's something that they would want to do. We have talked to some of the big electronic medical record companies like an Epic, and a lot of these companies do want these startups to be able to integrate into their EMR, because their electronic medical record, because that makes their electronic medical record stronger. They have an add-on. So Epic, which is one of the biggest players in the market, they have essentially an app store where you can add on applications into the electronic medical record. And Philip can speak more to like the actual nitty-gritty nuts and bolts of our integration engine, talking to the EMR. But I mean, we would be open to a potential partnership with an existing player to help, you know, get this in the market if that made sense for our company. Did that answer your question?
Yes.
Kind of?
Yes. I'm curious, so in order for them to get in, do they have to have a huge capital chest in order to get into the hospital? So do they already need to have $10 million before they can reach a first client? So these previous companies, how does they make it work? They just have a large cash.
Sure.
Depending on what the software company is and what the extent of the work that they're going to be providing to the hospital, one of the facilities here in St. Louis just put a new EMR in, and it took $1 billion to get that system into a large healthcare center. Our particular software here, it's probably going to require a lot more human capital to get it in. And so it's the expense for us to get into a facility is going to be more people on hand, writing this API integration, and then also to the gentleman's point over there, teaching people how to use these interaction recommendations, and then giving them the tools to do it. So for some software integrations can be as much as $1 billion. Our integration is probably going to be less than $20,000, and then a lot of human capital to make sure that there's compliance to the product, and that the nurses and the technologists and the physicians are using those interaction recommendations and understand the language behind them.
All right, well, thank you very much. Put your hands together.
Thanks, guys.